So the world is on fire, and millions of people stand to die globally from a new coronavirus. But at least libertarian free market capitalism will go with it this time. At this point, basically every country on Earth has done something to stop it from spreading faster, some with more success than others. It becomes clear that the only way to defeat a global pandemic is not through economic Darwinism, surprisingly, but with strict government intervention. Now, most libertarians I see online talking about the pandemic do exactly what they do with climate change. They downplay the severity of it significantly or pretend like it'll just go away on its own. But what is almost comically turning out to be a live demonstration of the failure of free market economics to counteract the virus just shows how much of an outdated ideology it really is. Before we get into why it is wrong, we should probably get into why this just isn't another flu. Right-wingers will undoubtedly respond to this video with the fact that there's only a 2% death rate in some countries. It's like 9% in Italy, I think. They'll insist that it isn't a big deal trying to eliminate it. Barring how ridiculous that is, the death rate isn't necessarily the worst part of COVID-19. Of course, at 2%, 10 million people infected will produce about 200,000 dead. Spread across the entire US economy is about 4,000 per state, yes. But what worries medical officials isn't the death rate, it's the hospitalization rate. As global health expert Alana Syke puts it,
I'm not going to talk about death rates in this talk because frankly nobody can agree on the COVID-19 death rates right now. But one number we can agree on is that about 20% of people infected with COVID-19 are going to need hospitalization.
At that, our 10 million infected produce 2 million people who need hospitalization, to varying degrees, meaning 40,000 people per state on average. Although, because it's a disease, most of these will be in clusters, probably focused on large population centers. But assuming an even distribution of 40,000 people per state, this would be an unbearable load for a country where our largest hospitals have, 200 beds max? And this disease is much more contagious than the flu, too. The flu has an R0 of 1.3, meaning that 1,000 people will infect about 1,300 people. For COVID-19, for every 1,000 people infected, they will infect 2,000 or 3,000, roughly. The last flu season had 36 million people infected, 10% of the US population. At that point, if 1 in 5 of those people needed hospitalization, it would be nothing short of catastrophic. Of course, it's not anticipated to get as high as 36 million, yeah. But at its max, in Ohio alone, we're estimated to see 6,000 to 8,000 transmissions per day. At that point, you wouldn't even die from coronavirus. Basically, anything that requires hospitalization would have a higher death rate attributed to it because medical staff would be so overburdened. Which is why this simply isn't another flu. This is literally a disease which could destroy the global medical system as we know it. The obvious counterexample that right-wingers throw out when this comes up is Italy announcing that it wouldn't give medical attention to elderly in the presence of high patient load. The right latched onto this as an example of the inefficiency of the Medicare for All system, which many industrialized countries utilize today. But reality tells a different story. Rationing medical care is the most efficient option when it comes to a pandemic of this magnitude. You see, Medicare for All doesn't mean infinite medical care. It means rationing medical care according to need. Italy's top medical officials have recommended that people with higher chances to live and more years left to live will be the most efficient way to divide the precious resource that is medical care. A resource that is getting more and more divided as the virus spreads through Italy's disproportionately older population. As one doctor put it beautifully in Rome, if you have a 99-year-old male or female patient, that's a patient with a lot of diseases. And you have a young kid that needs to be intubated, and you only have one ventilator. I mean, you're not going to toss the coin. This is the definition of efficiency. Choosing who should get medical care to maximize survival instead of letting a mixed bag of patients, old and young, clog up the medical system, ultimately taking up more resources to save the exact same amount of people, or even caring for the same amount of people and having a lower success rate. It might sound brutal and authoritarian to a libertarian, but the other option isn't much better. And capitalism has rationing too, really. See, the thing is though, in capitalist healthcare, the products are rationed according to who can pay for it, not based on need. And how the free market system works would only worsen the pandemic exponentially. How market pricing works is based on supply and demand. And during a global pandemic, when the amount of hospitalizations can double or triple in a matter of weeks, the price of healthcare would skyrocket, making it virtually inaccessible to anyone but the rich. And even they would have to pay 2 or 3 times the normal medical cost. It's a system which benefits nobody, except for the wealthiest, and even they would have to overcharge for it. By no one's definition is this a good medical system to have during a pandemic. So this alone is reason enough to completely throw out laissez-faire capitalism as a whole. But if the fact that the entire global medical system would be unsalvageable isn't enough to convince you, it gets worse if you put the smallest amount of thought into it. Alright, let's say you're a libertarian and you think that billions and billions of individuals could all simultaneously fall in lockstep with zero coercion from a higher authority and defeat the virus. What would they possibly do? Well, let's look at several arguments that libertarians would make about this. And for this, I actually asked about a dozen different self-described libertarians what they would do to stop the global pandemic. And I got 4 answers, all of which were about as helpful as you'd expect. A, do nothing, it's just the flu. B, do nothing and it'll just help our immunity overall. C, self-quarantine. And D, it's a conspiracy being propped up by the Democrats to sink the economy. So I'll start off with the only serious answer that I got, self-quarantine. People are already breaking quarantine protocols when they absolutely 100% know they have COVID-19. So expecting literally everyone to do it is just absurd, especially when no one can make them do it. And this is when I discovered the fundamental flaw in libertarian thinking. We live in a society. That's right. It might seem hard to believe, but the actions of society as a whole ultimately have consequences on the individual as well. And as you might expect, just letting everyone kind of sort things out themselves wouldn't really work. So what would a global self-quarantine look like? How long are those who listen to the quarantine going to hold out? Days? Weeks? Months? What happens when these people just stop going to work and they can't afford to pay their mortgage or rent? How effectively will they be able to quarantine themselves when they're homeless? And even if you suggest a rent or mortgage strike, how long would people live without power and food? Or God forbid, internet? And essential workers are constantly at risk of infection as well. So having a huge amount of the population outside working and carrying on life as normal would never actually work. Especially when people are, just going to the beach while they're supposed to be in quarantine.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying. We've been waiting for Miami spring break for a while. About 2 months we've had this trip planned. 2-3 months. So we're just out here having a good time. Whatever happens, happens.
Something tells me that self-quarantine wouldn't do anything to actually stop the disease. And the free market guarantees no paid sick leave. And there are already businesses that wouldn't even shut down if it wasn't for government forcing them to do so. Hell, in Ohio, there are currently many factories and non-essential businesses who have remained open even after the governor shut down all non-essential businesses. When I called my local health commissioner about my work being open, they said, "We're getting too many calls to go out and look at every report we get." Many of these businesses are exploiting this and saying that they're essential manufacturing, which is nonsense in most cases, like Whirlpool, a bathtub factory, or my local box factory. Expecting most or even a small portion of these businesses to shut down on their own is simply naive, and it ignores reality. Hell, it ignores the basic fundamental principle of capitalism, ever-expanding profit despite the cost to humanity. The second option, do absolutely nothing, which I've already gone over in the worst-case scenario above. 3, do absolutely nothing, we'll just let the virus do whatever and it will help our overall immunity. I'm assuming millions of people dying was factored into the equation, which is oddly Nazi-esque, isn't it? The cleansing of an entire nation of people to weed out the weak? Irregardless of whether or not this confirms the libertarian Nazi pipeline, this both doesn't contradict my worst-case scenario and shows a direct lack of knowledge about how immunity works. You see, we lack an immunity to the virus because it hasn't existed yet. It's brand new. It wouldn't matter if we had, say, an immunity to the Ebola virus. Our immunity to the coronavirus family wouldn't be affected whatsoever. We could easily take much less drastic solutions like, not letting millions of people die and actually containing the virus. Also, there's absolutely no guarantee that this virus wouldn't just keep out-mutating our antibodies and continually infecting us like, the common flu. In the last month, the virus has already went from human to dog and human to cat, indicating that it evolves at least as rapidly as the flu. They're pushing a harebrained scheme to basically genetically engineer society for basically no other reason than to prepare for the virus, which arguably could be more easily stopped by the government just stepping in. Essentially, what they're saying is similar to, the government could stop an enemy nuke from destroying the city, but don't worry, we can just learn how to survive in a post-apocalyptic wasteland. And number 4, it's all a democratic hoax to destroy the global economy, which, I'm sure they have concrete evidence for and just haven't put forward yet. And 5, I'm just going to throw this one in because it's probably going to come up eventually. Charity. Libertarians always bring this up as a replacement for government intervention, but if hundreds of millions of people across the globe are getting this disease, how could they adequately cope with inflated medical costs and sheer volume of those in need? Not only that, assuming that people would be self-quarantining on a massive scale, how could a large number of people afford to donate to charity if they're out of work, sick, without pay? Neither of these two are actually feasible with zero government intervention in the market, and charities would be incapable of providing billions of dollars in inflated test kits and treatment costs across the global economy. Also, just an aside to these 5 arguments, there is a significant lack of testing being done in the United States, and even here, testing is guaranteed without payment. Why? Because lack of tests would do the exact same thing as lack of doctors, jack up the price of testing because of low volume and high demand, making most poor people, those who work at low-wage jobs and typically interact with hundreds of shoppers on a daily basis, unable to get testing done, which would only ensure the disease spreads faster than it already is. It's clear that the free market wouldn't be capable of regulating a disease of this magnitude for anyone who has thought about it for more than 5 minutes. So let's see what other countries have actually done to stop or slow down their spread of COVID-19 and compare that to free market idealism. First and foremost, China's extreme measures to shut down the virus have almost stopped its spread completely. Well, within China at least. WHO officials who entered the country praised the Chinese medical system as they mass diagnosed thousands of people in just one day, built entire hospitals in about a week, and quarantining basically the entire state of Wuhan, shutting down its economy and risking its recession-free status, while also damaging global trade as a whole to save lives. While in the US, the plan is to limit the amount of contractions of disease over a longer period of time to stop hospital overload, China's plan is to stop the disease entirely. They effectively quarantined the entire state of Wuhan so that the virus has nowhere to run to. It can't infect anyone else. Now society is beginning to return back to normal, and those who are in isolation are being treated. About 6,000 still have the virus, and it's estimated that soon China's economy will be back to normal. They've even resumed railway manufacturing in Wuhan while the rest of the world plays catch-up, and they've even started opening up. Second, South Korea. From the very beginning of the outbreak, the South Korean government thought ahead and stocked up on test kits, providing them free of charge to their citizens and testing as many as 15,000 people a day with the capacity to test 20,000 per day. If one person is confirmed positive, the government sends out texts to the entire neighborhood telling you that someone in your area has been infected. If even one person is infected, they will go through systematically and test everyone that you've come into contact with, your entire family, coworkers, everything, to snuff out entire clusters of infected, ensuring that the virus doesn't spread even further. Governments have stepped in across the globe to shut down schools, restaurants, and activities with large amounts of people. The only places actually trying to find a cure are government agencies or heavily funded by governments. The tests in South Korea were developed by private companies, with orders, funding, and significant help from the government of South Korea. And no libertarian pundits are even coming up with solutions to the actual problem, only crying about how this is going to lead to martial law. When the truth is, the US government wants to stop it as soon as humanly possible to avoid complete and total market failure. But what happens when the only cure for a global pandemic is significant government intervention? If you enjoyed the video, please like and subscribe. I'm currently making a video on the future of NATO and what I think will happen to it. If you think I missed anything, let me know down in the comments. And if you have absolutely anything wrong with this video, I'll gladly debate you over it. Have a nice day.